You got me? One is telling you you got something wrong. Either you got heart failure. If you're coughing up blood, you either got heart failure and blood is accumulating in the lung and it's got nowhere to go, so you're coughing it up. Or you got bronchogenic carcinoma of the lung and you're coughing up blood because you outstripped the blood supply. And now the blood's leaking out into and you're spitting it up. You ever understand? So hemoptysis is an indicator of serious problem with the lung and the heart. Coughing up blood. But if you're throwing up blood, oh, that's Barrett's esophagus. That's complications to the GERD. So GERD leads to Barrett's esophagus. Esophagitis, they call it. Esophagitis. And Barrett's esophagitis will lead to what they call carcinoma in situ. Carcinoma in situ. That means it's like in vivo. You're a step away from cancer. The next step is esophageal cancer. That's the changing of the mucosa. Didn't I tell you we changed the mucosa? The Barrett's esophagus changes the mucosa. What am I going to make the esophagus mucosa look like? If I'm going to change it, what am I going to change it to? I'm sorry? Guys, don't be afraid. There's no wrong answer. Look, hey, so I'm esophagus. I'm between the laryngopharynx and the stomach. And I'm getting conditions that look like stomach. What do you think my esophagus' mucosa is going to look like? Like esophagus or like stomach? Like stomach. Do you see? And it changes. It goes from stratified squamous, non-keratinized, nice and wet with plenty of glands, lots of cells to prevent erosion while you swallow the food bolus. And we're changing it to what? Simple columnar with glands that are meant to secrete large amounts of bicarbonate. What? Yeah, I'm esophagus, not stomach. You got me bad. Sure enough, it weakens the wall. And these people commonly who have Barrett's esophagus will also have what? Herniation of the wall, also known as a cardiac what? A herniation in the cardiac region. Anybody know what they call that? A herniation of the stomach in the cardiac region into the area right where the heart is. Huh? Look it up. Look it up. It's the most common form of hernia. It's the most common one. You see me touching my belly because I got a hernia there. I have a very small, tiny hernia there. Where the connective tissue, the skin of the umbilicus is kind of split up, and then the fat, the greater omentum, is kind of pushing through. I can feel it, but it used to be worse. Now it's going away a little bit. I'm walking regularly with my doggy. My doggy. Get along, move along, little doggy. And for years I've been waiting to say that. Well, it was making fun of me yesterday. Move along, little doggy. What do you call it? Hiatal hernia. So that cardiac region hernia is referred to as a hiatal hernia. Guys, you see why you want to be messing around with this? You see why you want to be fiddling around with your higher ion concentration? You see why you want to do everything to get this shit in check and immediately? And don't be taking no medications to try and fool yourself into thinking everything's going to be okay? Because there is no magic cure. There is no magic pill. I get a whole bunch of problems. Now, separate of that, now check this out. I can have enough of the wall damaged where then I can start fusing to my trachea. So where my esophagus and trachea start forming fistula. A tracheoesophageal fistula. Everybody see that? Now, I'll tell you of another patient who did not die, who had acid reflux in excess. Guys, if this is closed tight, and this one's open, and that one's open, and I have enough over time, where's it going? Up. Everyone agree? Well, it goes up. What goes up must come down. So either you spitting it up, and sure enough, people who suffer from acid reflux in excess, look at their teeth. Their back molars, black. People who vomit, bulimics. I can tell you, as a wrestler, I used to purge regularly to make weight. So when I come in, they'd be like, "Oh yeah, you're 2 pounds overweight." What? Let me go get some gum. Be spitting, chewing gum and spitting, and then right before weight, vomit. You get all the water content out. Sure enough, you make weight. Afterwards, after the wrestling match, you'll pig out. No big deal. But sure enough, every time you expose your dentin, your enamel, to acid, it strips it away. Every time. That means every time you threw up, go and count them. If you're inducing yourself to throw up or you just threw up because you got sick, every time you threw up, the acid that came from your stomach literally stripped away some of the enamel of your teeth and will increase your risk for dental caries. But dentition and teeth are about what? About chewing and mastication. Everybody agree? So we're still talking about GI, aren't we? Follow? And because they're so close in proximity, sure enough, I swear to you, the trachea sits like this. Everybody see? And the C-shaped cartilaginous rings are facing out like this. And right up here, there's my voice box, my larynx, just like that. Everybody follow? Just like that. I know my fist, right? And that big Adam's up. Right? So there it is. Right behind it is the esophagus. So you see why, if the esophagus gets inflamed, it can link up with the trachea, at least the upper parts, and you get that tracheoesophageal fistulas. Now you get acid moving from esophagus into trachea and into lung. Did everybody hear me? It doesn't have to. It doesn't have to connect here. It can come all the way up and through, and then down into the respiratory zone. What do you think is going to happen if acid goes into the respiratory zone, guys? It's going to strip the lining of your lung away. Does that sound like a good idea? I'm going to strip the alveoli away. Does that sound like a good idea? Now, if you don't die of acute respiratory failure, you understand? Because that's what happens when firemen go into hot burning buildings, even with oxygen tanks. Did everybody hear me? The heat can be so extreme that as they breathe in that hot air, that's why they have tanks, oxygen tanks, you see? But those oxygen tanks, what? They're on their backs. And they can get hot, can't they? So the temperature of the air that they're breathing can get hotter, and it can literally burn. Just the temperature of the air that they're breathing can burn the lining of their alveoli away. Does that make sense, guys?
Can it remember?
Yeah, to some extent. But if it's too bad to burn, then you're going to get fibrotic change. That fibrotic change in the patient who I had. So here's the patient I had. Patient came to me. Here's the patient. Patient came to me as a referral. Again, I'm not a practicing physician. But sure enough, difficult patients find me. So I get this referral. I go and I tell her, okay, well, send me all your data. I'll look through it. So I looked through it. About 3 weeks, I'm chopping on her data. I'm chopping on all her history. And I said, all right, time to meet. Let's go meet. So we're going to. I met her at Einstein Bagels over there on 72nd US 1, just past Lexington. So we sat down, and within minutes of me sitting there watching her while she was eating, I immediately knew what was going on with her, because every time she would swallow, and even when she wouldn't swallow, she would grimace. Everybody see that look on my face? Look like I swallowed what? Something that tastes nasty, right? So every so often, she's getting this acid reflux. And she's swallowing it, trying to get the acid back down, which she doesn't realize it's coming up, and it's moving up into the larynx and down into the lung. So the reason why she came to see me is because a week and a half into her being referred to me, shit got complicated because she was at Baptist, and they diagnosed her with a foreign object deep in her tracheal tree, and she was scheduled for surgery. So they went in to pull the growth out of the center of her tree. which is, it's preventing air from coming through. And when they go to pull on it, her heart starts to go funky. So then they had to stop. So she almost died. And the second time around, they intended again to try and pull the foreign object out. And the heart again stopped. She almost died. So she came to me after this. And of course I looked and I said, well, guess what? I said, my whole consultation is free. I'm not getting paid anything for this. But I told her, I says, what you're suffering from is acid reflux, and what it's doing is it's going into your larynx, it's burning your esophagus, and it's creating a huge reparative response that's causing fibrous change. And what they're pulling on is actually fibrotic lung tissue. And that's why you're going into heart failure. So, yeah, you got to deal with the acid reflux. That's your main priority. Sure enough, the following week she had an appointment with a doctor in Denver, Colorado, that she flew out there for the whole week to get a study done. She went out there the whole week, got the study done, came back. You know what she did? She called my wife. She told my wife, your husband was, what the doctor told me when I was in Denver is exactly what your husband told me. And then, of course, the one thing that he didn't say that I told her was, change your eating habits. Eat more papaya when you get that acid reflux. Papaya pills, little compressed papaya pills, you can swallow them and chew them.
Right.
No, the papaya pills, they're pressed papaya, natural. You get them at any health food store.
I take psyllium husk.
And you can just throw the
for fiber, no?
No, it's not for the fiber. The papaya has papain. It's an enzyme, but it's an actual protein that actually interacts with the hydrogen so that they don't interact with your lining of your digestive tract. You see?
But you can get it from eating papaya too.
You can get it from eating papaya. But what's cool about this is that the papaya extract, the papain, they've taken it and extracted it and put it into pill form so that you can just chew on that instead of chewing on Rolaids and Tums. You see what I'm saying?
Yeah. Better.
And my grandfather, man, break my heart. Stubborn old man. I loved him to death, but stubborn. You know? Any questions on this stuff, guys?
You said how the hot air can burn the alveoli.
That's called acute respiratory distress syndrome.
So does that happen to smokers too?
Yeah. Don't matter what you're smoking. Understand? No matter what you're smoking. I'm not judging.
What about vaping?
I can't. Yeah, vaping. We haven't done enough studies on that yet. We'll find out what's happening, but yeah. So, and then separately, remember, smoking cigarettes is different from smoking marijuana. And I'm a huge proponent for smoking marijuana. Don't get me wrong. I'm on recording. I have to be careful. Right? But cigarettes, I am not a huge proponent for smoking cigarettes. There's only one case scenario in clinical medicine where we recommend somebody to actually smoke cigarettes, and that's a very rare thing, extremely rare thing. That's when they need nicotine that they don't produce. All right, that they need, because nicotine is an addictive neurotransmitter that they add to cigarettes. That they added to cigarettes for years. They didn't let anybody know about it. And now
they add even more now.
Now they add even more, and now it's even worse. Now they got the e-vape, which is pure nicotine.
Right, that's what I was wondering.
And it's like, yeah, you guys don't realize, man. You're fucking around with your neurotransmitters, man, and and that's brain, GI, and everything. You want to take a neurotransmitter? Good luck with that. I got you. Good luck with that.
There were someone was saying that it's the vape is leaving moisture on your lung.
Which it would.
So this is what it's
Because you got the tar too. So there's always the tar issue, and that's part of the issue. So as tar continues to build up, no matter what form it's in, when that liquid cools, it becomes semi-liquid, if not a solid, and then gets absorbed by the cells, or it stays in a liquid form and gets absorbed by the cells. In any case, it's supposed to be in gas form. That's what you're breathing most of it in. This is the reason why you can tell the e-vapors, they'll get that chronic cough. So you have to kind of, if you're gonna vape, then you kind of,
But
you know,
then
you gotta
it's
kind
like,
of
oh, it's a healthier
vape for a little
form.
while, and then not vape for a little while, and then, you know, smoke whatever you're smoking, you know, separate of the vape. So, but then if you smoke the, you know, if you're smoking bud or you're smoking anything that has stems and leaves and everything else in it, there's still what? Oxygen-free radicals that you're consuming. Can't get away from that. But I mean, you walking around, you're getting oxygen-free radicals that you're being exposed to. This is the least of your worries. It really is. Should be more worried about that carbon-14 that we're consuming regularly that we can't seem to get rid of. All right? Because it's radioactive. Or the iodine that's radioactive, right? Or all the radioactive isotopes that they've been dumping into our environment for years, ever since they started our nuclear program. And Russia's been doing the same. That people should be more worried about that than they would be about GMOs. Come on, man. Some people, man, I tell you. Don't get me started. All right. So, guys, we stopped at stomach, right? So we're back to where we started yesterday, right? But I gave you some more details in terms of diseases. So you have GERDs, which is gastroesophageal reflux disease, Barrett's esophagus, and then what they call carcinoma in situ, which would lead to esophageal cancer. Separately, if you have GERD, you can get a hiatal hernia in the cardiac region. It's a herniation in the cardiac region. And thirdly, you can get blood leaking because the mucosa and the blood vessels in the submucosa and the re-architecturing of the mucosa in Barrett's esophagitis can lead to the leaking of blood into the esophagus, so that when you throw up, there's blood. When you spit up, there's blood, and that's called hematesis. That's different from when you cough up blood, which means it's coming from the lower respiratory tract. Everyone agree? And that can be, it doesn't necessarily have to be bronchogenic carcinoma of the lung. It can be laryngeal cancer. If you're a chronic smoker, you can have cancer of the larynx. You lose the voice. They put the device in there for them because they lose that. Understand? They get cancerous lesions on the vocal cords, so they have to remove the vocal cords. And instead they'll have to put the little device in there for them to speak. Okay? Okay? And you don't have to smoke. You could be working around smoke. Any smoke. You understand? Regularly as an industrial worker and get exposed to this stuff and get, the larynx, or the lung. Remember we talked about that, right? Lung diseases? Yeah? So let's go back to lung. Since I jumped into respiratory, let's go back to lung. Let's go back to lung. I don't want to. We'll go back to duodenum in a moment. Oh, my eraser? My big eraser? Okay. Give me a small eraser. All right. So can I erase this? Everybody give me erasing this?
So where this was proposed, blood leg.
Okay. It's all in the video, so. Right. Yeah, now? Take a picture. It's on the video. So remember, we stopped at duodenum. Well, we stopped at stomach. So if I were to list up your stomach, and then duodenum, jejunum, ileum, right? And I want to make, because remember, we're talking about the mucosa. Remember, the stomach lining of the mucosa is stratified squamous. Simple columnar. But it's folded, the basement membrane is folded downward. Then in the duodenum, the basement membrane is going to go up and down. And not only is it going to go down, it's also going to go down and disrupt that simple muscular smooth muscle layer That's the muscularis mucosa. That's the delineating line of what's mucosa from submucosa. So in the stomach, you didn't see that disruption of the muscularis mucosa. So the gastric pits, which do become quite large, but they don't disrupt the muscularis mucosa, so they don't go into the submucosa. Everyone agree? But in the duodenum, the glands become so well developed that they go and take up and encroach on the submucosa. So what do we call those? Submucosal glands. And since they're in the duodenum, then we'll call them duodenal glands. Did everybody hear me? And those duodenal glands, that are also known as submucosal glands, were given the name by a guy who found them, and they called them Brunner's glands. Did everybody hear me? So Brunner's glands, intestinal glands, duodenal glands is the same name. Intestinal glands are big umbrella. Everybody got me? But in the duodenum, those intestinal glands, also referred to as submucosal glands because they extend beyond the mucosa into the submucosa. They're also referred to as duodenal glands or Brunner's glands. You understand, guys? But we got away from proper name Brunner's glands. We don't use that word no more. They don't like using proper names anymore. They want to get rid of proper names. So we call them duodenal glands. You understand? They're duodenal, they're submucosal, duodenal glands. And what do you think their job is? To secrete mucus and bicarbonate to neutralize the pH of the stomach. Does that make sense? Because the stomach is opening up the pylorus every so often because the pancreas is telling it to do so. Make sense? Yeah, absolutely. Guys, would this make sense too? I'm sorry, not the pancreas, I meant duodenum. If the duodenum tells the stomach to stop secreting, then what is it really telling the duodenum to do? I'm sorry, if the duodenum is telling the stomach to stop secreting stuff to it, then what else is it indirectly doing? So if my stomach's job is to receive everything and then churn it, and then every once in a while spit it out, and the organ who's telling it to spit out is telling it not to spit out, then what's the only other option? To churn, to keep churning. You understand? To keep churning. Don't let it leave. Don't let it go up to the esophagus. You don't want that, right? Keep churning it. And if my duodenum is in proper sync with my stomach, then I shouldn't be getting any excess acid moving into the esophagus because I'm taking a little at a time, right? The duodenum is demanding of the stomach every once in a while to give it a little at a time so that it doesn't accumulate and go into the esophagus. Get me, guys? So then, should I be looking at your overall electrical activity in your GI if you're suffering from chronic acid reflux? Yes. Maybe. Should I be looking at whether or not the lower esophageal sphincter is too laxed? Maybe. Should I be looking at if the pyloric sphincter is a little too tight? Maybe. Guys, you see what I'm saying? If the pyloric sphincter is too tight, then when it's told to secrete, it doesn't open as much as it should. That means more stays in the stomach, which means more of the contents stay in, which means more than likely it's going to come up. You see? Could you eat things that would promote the stimulation? There's medicines that they use to help stimulate the GI activity. They call it motility. Motility. You ever understand that? The mobility in the GI tract is referred to as motility. Okay? Motility. And don't forget, we also talk about transient time, yes? So if I have a tube, the lower, the increase in time, right, allows for an increase in absorption. Everyone agree? And reabsorption, for that matter. And secretion and excretion, so If I decrease the time that I spend in the tube, then I decrease those same characteristics. Everyone agree? That's where we get constipation, too much time, pain meds, too much time, versus too little time, right? That decreases absorption through the tube and reabsorption through the tube. And if that's really large, then we're talking about diarrhea. Okay? Yes?
Motility and peristalsis, the same thing in this case?
Yes, motility is a big umbrella. Peristalsis is the innate ability of the tube to contract on its own. Because you got smooth muscle running longitudinally, the length of the tube. So when they contract, when smooth muscles contract, they're going to shorten the length of the tube. See that? And then the others are circular. So they're 90 degrees to the movement of food. So all you got to do is what? Relax it to receive it, right? Relax to receive the bolus, and then, so relax in front of it and constrict behind it. So we're constantly relaxing in front and constricting behind. Relaxing in front and constricting behind. Those two, the movement of the smooth muscles longitudinally, along with those of the circular, they're going to cause peristalsis. Peristalsis is an innate ability of these smooth muscles to contract without nerve impulse. Without external nerve impulse, meaning without impulse from sympathetic and parasympathetic. The reality is that what? We have more neurons in the wall of the GI tract than we do in the spinal cord. Yes? I'll write that on the board because I mentioned it before. There are the number of neurons in the wall of GI is greater than the number of neurons in spinal cord. Now watch, guys. So my jejunum is going to look just like my jejunum and ileum, they're going to look just like my duodenum. The only difference is, see that villi structure? It's going to get bigger. And then bigger. Why would I want to get bigger and bigger? What? More absorption. Increased surface area, more absorption. More reabsorption, more secretion, more excretion. You got me? Because by the time I get to the ileum, hey, either you absorb it there, or guess what? It's fecal material. So the ileum moves in to the cecum, and then you have your iliocecal valve. And now you're in your cecum, ascending colon. Remember, cecum leads to the ascending colon, which is going up on the right. So this is the right side. Then the T colon comes across here. And your D colon comes down into your S colon. And your S colon into your rectum. And your rectum, this pouch, leads into your anus. And your anus is puckered shut, hopefully, unless you've been playing with it too much. I don't want to go there. I'm not judging. Whatever puts a smile on your face is all good. But just keep in mind now, you stretch those muscles out, there's no way of fixing that, right? So that means that you're not going to be able to control your bladder. I mean, you're not going to be able to control your rectum. All right? So you're going to be leaky. Right? Yeah. All right? You're going to be leaky. Right? Because remember, we're always full of shit. Yeah? So if we're always full of shit, and then you're leaky, then, right? Then you got Hershey squares on your underwear. They just don't have the special Hershey stamp on them.
Nice way to end the class.
Any other questions?